When we talk about normal sinus rhythm, we're describing the gold standard of the heart's electrical activity. This is the rhythm we want to see, because it means the electrical impulse is starting where it should, in the sinoatrial node, or SA node, and traveling smoothly through the normal conduction pathway. So what makes a rhythm normal sinus? There are specific criteria. First, both the ventricular and atrial rates fall between 60 and 100 beats per minute in adults. The rhythm is regular, meaning the intervals between beats are consistent. The QRS complex is usually normal in shape and duration, although in some patients it can be regularly abnormal but still consistent. Each P wave should look normal, have a consistent shape, and always appear before the QRS complex. The PR interval is steady, measuring between 0.12 and 0.20 seconds. And importantly, there's a 1-to-1 ratio between P waves and QRS complexes. Each impulse that begins in the atria results in a ventricular contraction. When all of these features are present, we can call it normal sinus rhythm. It's a reassuring sign that the heart's conduction system is functioning properly. But here's something important. Even though normal sinus rhythm is considered healthy, resting heart rate matters. Research has shown that for every 10 beats per minute increase in resting heart rate, the risk of sudden cardiac death, atrial fibrillation, heart failure, coronary artery disease, stroke, and overall cardiovascular disease increases. So while the rhythm may look normal, a higher resting rate is not something to ignore. In summary, normal sinus rhythm reflects healthy conduction through the SA node and the rest of the heart. It's defined by a rate of 60 to 100, a regular rhythm, normal P waves, consistent PR intervals, and a 1-to-1 P to QRS ratio. It's the baseline by which we compare all other rhythms, and it's an important marker of cardiovascular health.